Hello, beautiful people. Thank you guys for joining me again for another episode of Ask Me About DT, where we discuss everything about down there, referring to the pelvic region and pelvic floor related topics. My name is Nadia Mills, and I'm a physical therapist, and I specialize in the treatment of pelvic floor dysfunction and what I call abdominal pelvic health. Because once I started treating pelvic floor, I realized how everything is so significantly interconnected. It opened up my eyes to other treatments that I felt I had done everything for, but I wasn't quite getting the results. So now that I'm treating pelvic floor, I am a much better back therapist. I'm a much better hip therapist. I'm a much better neck therapist, believe it or not. So the pelvic floor is significantly linked into all the other parts of our body. Just about every muscle or every point that is linked into your body is attached to your pelvic floor from your knee all the way up to your head. So today I wanted to talk about why it is, or what are some of the reasons why the pelvic floor gets weak. And a lot of us, we might think, pelvic floor gets damaged from birthing, so giving birth to children, so it's a woman's issue, but it's not. The pelvic floor affects just about everything in our body, and here are roughly about 8 reasons why it can become weak. If you're more of a visual person, I have done a short on 6 reasons the pelvic floor become weak. I've also done a little bit longer video on 7 reasons that the pelvic floor becomes weak. And this podcast is going to talk about roughly 8 reasons why the pelvic floor becomes weak. So this is by no means an all-encompassing list, but these are the main ones. And so let's begin. The number one reason the pelvic floor becomes weak, and I want to make sure I'm starting off with this because it ties in so significantly to so many other reasons that come up. So the number one reason, can you guess? Well, the number one reason is diet. Unfortunately, our diet has become very pelvic floor unfriendly, if I can say that. And what I mean by that is a lot of us, we have diets that have highly processed foods, highly processed meats, highly processed carbohydrates. And so a lot of the fiber has been taken out of our food. And I have seen some commercials or some ads that's saying that fiber don't help you poop. Well, that's a lie. The body doesn't necessarily enjoy taking like a fiber supplement, but foods rich in fiber, both soluble and non-soluble fiber, helps you to form a good, healthy stool. Our bodies were designed at a time where we had to chew on some pretty rough stuff to get the amount of nutrition that we need. You know, we didn't have everything nicely cooked and prepackaged. Our bodies were designed to process a lot of fiber so that we can get the nutrition out of it. Our intestines are like 15 feet long. Roughly 10 feet of that is the small intestine, and that's where we do all of our digesting and reabsorbing of nutrients into the body. And about 5 feet of that is our colon, and that's where we process the rest of what's left over to produce stool. So packed into our core, into our stomach, we have 15 feet of intestine that is dedicated to digestion. And so food and waste products have a pretty long way to go from your mouth out of your rectum as stool. And so it needs that fiber to create bulk to help your body push it along. The other thing, our intestines, we cannot voluntarily contract our intestines. It is a involuntary muscle movement, and it's a very slight movement. It's called peristalsis. It's where little sections of the intestine moves and creates kind of like a wave formation that helps to push the material along. Like I say, you can't do like a maximum contraction on this. And so your body does need that bulk in terms of having something that it can push against. If we don't have good fiber in our diet, it is very difficult for the peristalsis to work and push along the substances that are in our intestine. So our foods right now, it's highly processed and very refined. And what I mean by that is, a lot of our breads, like you would find a lot of, breads in general, that's processed. So you've taken wheat, and you've ground it down and made it into flour, and then you've mixed other things together, you've created bread. Whereas in the past, our ancestors would probably pick the meat and, if anything, probably boil it, but that would be about as much processing that would happen. So again, processing means you have taken the food substance and you've either made it from a solid into a powder, or you've added other items to it to make it a little bit palatable. And also by cooking it, we soften it, and that's called processing. But yes, we need to process. But besides the point is, our food now doesn't match the expectation of what our intestines need to function properly. The other thing, so sometimes we think we're eating healthy, but something as simple as the difference between an orange and orange juice, or an apple and apple juice. So orange juice and apple juice are processed. You took the fruit, you peeled it, you smashed it, and you extracted the juice from it. And if you look at a container of orange juice or apple juice, well, if it's the orange juice with the pulp, you will find fiber there. But if it's not, you're not going to find fiber. If you ate that orange, or if you ate that apple, you would actually get soluble and non-soluble fiber going through your system, which would help you with digestion. So even something as simple as creating a juice versus eating a fruit causes us to lose some of that fiber that we need for digestion. So when it comes to food, you want to try to eat the food in its most original state as possible. Yes, you're going to have to cook it and so forth, but you want to try to get it, if you're looking at an ingredient label, let's say for example a package of oatmeal, it should just say oatmeal, not a list of 500 things and different products in there. You want your food to be as close to nature as possible. One of the simplest ways to try to get towards this is, once you start reading food labels, if you can read the ingredients without having to twist your tongue or have no clue of what those ingredients are, you're pretty much on the right track. So it should be simple ingredients, pretty straightforward, and as few ingredients as possible. So that way you know that you're getting a product that your body can recognize, and hopefully it'll contain the vitamins, the minerals, the fiber that your body needs in order to be nourished and also to form a good, healthy stool. Believe me, a good, healthy, well-formed stool is critical to good health. There's a saying that goes, "Let thy food be thy medicine, and medicine be thy food." It's a saying by Hippocrates, who we also call the father of medicine. Modern medicine has kind of gone a far distance away from thinking of food as medicine, but simply food is a very key important element in your overall health and daily function. And so there definitely are foods, and like I said, try to eat as close to nature as possible, because really that is what your body is designed for. As a matter of fact, right now, the food that we're eating is one of the major factors that is causing diseases in our body. Most of the non-communicable diseases are very much diet and food related, and also can be controlled with changes in diet and food. And for example, one of the key things that many people are dealing with is diabetes. One of the most effective ways, and we're talking type 2 diabetes, not type 1, one of the most effective ways to get diabetes under control is through your diet. Another common disease that many people are dealing with is high blood pressure or hypertension. This as well has a very significant food component. So diet plays a really important part in your overall function. And I just remembered we were talking about pelvic floor health. But yes, so your diet really is important through your overall health. And so here's how it affects your pelvic floor. Well, first of all, so we talked about low fiber. So you have difficulty with forming stools, and so it tends to lead you to constipation, or if you're not considered constipation, we could call it slow motility. So it's harder for material to pass through your intestines, and so it stays there longer, and so by the time it has formed into a stool, it becomes a little harder than what your body would prefer it to be. And then we have the habit of tending to push and force so that we can have a bowel movement, because this material is uncomfortable and too firm to just normally slide out. And when I say slide out, I mean literally, when you have a bowel movement, you're just supposed to sit there, relax, and the stuff should just come right out. So the diet and poor choices in our diet can lead to issues with constipation. And also there are foods that irritate our bladder and our bowels. And so food irritation can cause retention. It can also cause frequency, meaning you have to go to the bathroom frequently because your bladder is irritated. And many times people think they have a UTI or they're diagnosed as a UTI, but really it's because their bladder is irritated. And an example of this is sometimes if you don't drink a lot of water or enough water, your urine becomes extremely concentrated, and so it becomes very acidic. And so when that acidic urine is sitting in your bladder, it irritates the cells in your bladder. And what your body does to try to get rid of that irritation is your bladder starts to spasm, it starts to contract, and that sends a signal to your brain that you need to pee. And there might not be much urine in there at all, but because it's so irritating, your body wants to get rid of it. And so that can lead to frequent urination and really inconvenience you in your life. All right, so that takes me into the second cause of pelvic floor dysfunction. So like I said, diet plays a key in most things. The next thing is our toileting habits. So as I mentioned just now, if you have extremely acidic urine, it increases the frequency of which you would want to go to the bathroom because your body's trying to get rid of that irritation. But in our toileting habits, we also train our bladders to empty when it doesn't really need to. So for example, you're leaving the house and you go, oh, let me go to the bathroom just in case. Or you're at work and you're like, all right, well, I don't know what traffic's going to be like, so let me go to the bathroom just in case. So that just in case peeing is training your bladder and your brain to empty when it really doesn't need to. Your bladder has a certain capacity, and so normal range of needing to go to the bathroom is roughly between 1 to 2 hours, or sometimes even 3 hours. So if you're in the habit of going just in case, your body, your brain starts picking up on cues. So you may not need to, but every time you leave the house, guess what? You're going to go to the bathroom just in case. Every time you leave work, you're going to go to the bathroom just in case. And it starts becoming a habit where your body starts saying, hey, let's go to the bathroom just in case, whether or not you want to. But that's the pattern that you've trained. And so that frequency of going to the bathroom can start causing some dysfunction and actually some social anxiety, because you can end up in situations where, for example, you see a bathroom and your body says, let's go to the bathroom, whether or not you really need to. And so habits like that starts to develop into pelvic floor dysfunction, where you're starting to have the desire or need to go to the bathroom when your body doesn't truly need to. Some other bad toileting habits that we have is also some people are deathly afraid of public bathrooms. They will not use it no matter how long. Like some people will refuse to go to the bathroom. They can be working an 8-hour shift, 10-hour shift, 12-hour shift. They will not go to a public bathroom. And so they hold everything until they get home. There are some people, certain professions such as teachers, nurses, people in careers that the activity demands a significant amount of their attention, and sometimes for a 12-hour shift. So I deal with a lot of nurses because I am in healthcare. For a 12-hour shift, some nurses will not go to the bathroom. Some teachers, if they are in a classroom, and the children, they have to be there. They have to be there with the kids. They can't leave them. And so there are certain professions where you find people hold a lot, and that can cause pelvic floor dysfunction because sometimes that causes excessive bladder expansion. And sometimes it gets to the point where you can't hold anymore, or your bladder just can't hold anymore. It becomes weakened because of this type of behavior. The other thing is, some people, again, depending on whatever their job is, when they go to the bathroom, they're in a serious rush. So they go in, they try to get everything out so that they can get back to whatever it is they're doing. But like I say, a lot of times it is related to work, but some people also have that habit. They just want to get in and out without really taking the time. Like I say, a pelvic floor that is relaxed is a healthy pelvic floor, because elimination, going to the bathroom, whether you have to urinate or to have a bowel movement, is when the pelvic floor relaxes. It is opening to allow these things to come out. So when you go in and you're pushing and you're straining, you're actually kind of doing the opposite of what your body needs in order to release the waste products that it has. Another habit that can really be detrimental in terms of pelvic floor function and maintaining its strength and health is the use of laxatives. So some people, again, let's go back to diet. Some people, because of poor diet and other habits, tend to be constipated. Or some people believe that they should have a bowel movement every day. Normal is considered within 1 to 3 days, but some people, they have cultural beliefs or personal beliefs that voiding every day is a necessity. And so sometimes they will use medication. And so there's the camp where they feel like they have to void every day, and there's a camp where they're having difficulty just naturally voiding. And so a lot of people will use medications and laxative. And this actually, again, weakens the pelvic floor because it irritates the bowels and it irritates the muscles to create the ability for you to go to the bathroom. So these are some of the habits, the toileting habits, that can cause us to become weaker in our pelvic floor muscles. Now, I'm going to talk about my favorite topic in pelvic floor health, and that's constipation. You might think I'm crazy, but constipation is my favorite topic, not because constipation is fun, but because constipation is so common and it is one of the major culprits in causing pelvic floor weakness. And it does that because, like I said, if you're constipated, you're having difficulties with eliminating your stool, and a lot of times there's a lot of pressure and there's a lot of force. So you're forcing and you're stretching those muscles whenever you go to the bathroom. And over time, imagine a lifetime of forcing and stretching those muscles. You weaken them and eventually you start having difficulties. It may not be with controlling your bowels, but it might be with controlling urination. Also, all that consistent forcing and pressure can lead to prolapse, meaning the pressure downward causes a drop in your bladder, or if you're female, your uterus, or even your colon itself. And so prolapse can be one of the things that is triggered by constipation. Incontinence also can be triggered by constipation. Pain can be triggered by constipation. Hemorrhoids can be triggered by constipation. So yes, constipation is a very important topic for me, because once we fix that, a lot of times you can address a lot of other concerns that cause pelvic floor weakness. So I'm all about the constipation, not having it, but taking care of it and getting rid of it. But wait, there's more. So in regards to toileting habits, do you know most of us actually sit on the toilet wrong? I didn't even know that. Once I became a pelvic floor therapist, I learned that we are sitting on the toilet wrong. So let's go back again to our ancestry. Back in the day, before we had indoor plumbing, before we had outdoor plumbing, we used to squat. Yeah, if you wanted to have a bowel movement, you were going out in the bushes somewhere and squatting down and allowing your pelvic muscles to stretch and relax so that you can pass the stool. So one of the greatest inventions that I absolutely love is the toilet stool. So it's a stool roughly between 4 to 7 inches, and you sit on our modern toilets pretty much like you're sitting at the dinner table. You're sitting on a standard height chair. And so by using a toilet stool, You allow your knees to be raised above your hip level, and that allows your pelvic floor muscles to relax and open. And oh my gosh, if you have never tried this, you really should try to get one. You don't even need to buy one. You probably have something in your house that you can kind of prop up. I tell people sometimes just wear heels to the toilet. So if you have some 6-inch heels, wear them to the toilet. So, and I know that sounds crazy, but it actually works. So wear the heels, or find like a little box or something that you can prop your feet up, and try having a bowel movement or even peeing in that position, and see how much easier it is for you to eliminate without having to force. The other thing is also the way we breathe. So even our breathing can help us to eliminate when we're having bowel movements or urinating, because your diaphragm, which is your breathing muscle, it is all part of your core. Your pelvic floor is a part of your core. And a lot of times, if we're not breathing well, we also disrupt how our pelvic floor and our core muscles work. And so potty mechanics, this is what I call it. Potty mechanics is really important, to have your knees above your hips, and also to have a nice relaxing breath deep into your belly, not up into your chest, because you want the air to push downwards to allow you to release whatever waste product you are trying to get rid of. Wow, this is turning out to be a lot longer than I thought it would be. So I think I'm going to have to break this up into 2 or maybe 3 parts. But like I said, these are things that we have in our everyday life and we may not even notice. But I wanted to spend some time sharing this with you so you can really understand the significance of how your daily activities affect your pelvic floor. So to recap, so far, we have discussed how, number 1, your diet affects your pelvic floor. Number 2, your toileting habits affect your pelvic floor. So whether you're doing the just in case peeing, or you're holding because you don't like to use public bathrooms, or because of your job, those things affect your pelvic floor. Whether you're using stimulants or medications to create bowel movements that may not be necessary. Also, if your food is doing irritation to your bladder or bowel, or if you're having constipation and you're pushing and forcing. So diet and toileting habits are really big. And like I say, I think if we paid attention to these 2 key things, it would make a huge difference in preventing or eliminating many other aspects of pelvic floor dysfunction. And I'm going to do another podcast to continue with these very important things so that you can know how best to take care of your pelvic floor and be more aware in just your everyday activities that affect your pelvic floor. Thank you for joining me on this podcast. I appreciate you sticking out with me. And also, please remember to subscribe, give it a thumbs up, leave a comment. Let me know if you're enjoying this content. Let me know if you have any questions. Let me know if you have any suggestions. Also, I do free consultations if you have a personal question, or if you have just a more general question that you need more information for. So it's been my pleasure to take you on this journey. Join me again as we go for part 2 of, 8 reasons why pelvic floor muscles get weak.